What are 6 foods to avoid with an enlarged prostate? Before starting this topic, let's discuss about prostate basic details like: what is the prostate? The prostate is a gland in the male reproductive system that is located just below the bladder and in front of the rectum. It is about the size of a walnut and surrounds the urethra, the tube that carries urine from the bladder out of the body. The prostate's main function is to produce and secrete a thin, milky fluid that becomes part of the seminal fluid, which helps to nourish and transport sperm. The prostate also plays a role in maintaining the health of the male reproductive system and in supporting sexual function. Prostate problems, including prostate cancer and benign prostatic hyperplasia (BPH), are common in men as they get older. What are the causes of enlarged prostate? An enlarged prostate, also known as benign prostatic hyperplasia (BPH), is a common condition that affects many men as they age. It occurs when the prostate gland grows in size and begins to press against the urethra, the tube that carries urine from the bladder out of the body. This can cause urinary symptoms such as a weak urine stream, frequent urination, and the feeling of not being able to completely empty the bladder. There are several factors that may contribute to the development of an enlarged prostate. These include: age. BPH is more common in men over the age of 50, and the risk increases with age. Genetics. Some men are more likely to develop BPH if they have a family history of the condition. Hormonal changes. As men age, their levels of testosterone and other hormones change, which may contribute to the growth of the prostate gland. Diet. Some studies suggest that a diet high in red meat and dairy products may increase the risk of BPH. Obesity. Being overweight or obese may increase the risk of BPH. It's important to note that an enlarged prostate does not necessarily mean that a man has prostate cancer. However, it is important for men with BPH to undergo regular checkups and screenings to monitor their prostate health. What are the foods to avoid prostate? There is no specific diet that has been proven to prevent or treat an enlarged prostate, benign prostatic hyperplasia, or BPH. However, making certain dietary changes may help to reduce the risk of developing BPH or improve symptoms if you already have the condition. Some foods that may be beneficial to avoid or limit if you have BPH include: like alcohol. Alcohol can irritate the bladder and worsen symptoms of BPH. It is recommended to limit alcohol consumption or avoid it altogether. Caffeine. Caffeine is a stimulant that can increase the frequency of urination. It is found in coffee, tea, and some sodas and energy drinks. Spicy foods. Spicy foods may irritate the bladder and worsen symptoms of BPH. Acidic foods. Foods that are high in acid, such as citrus fruits and tomatoes, may irritate the bladder and worsen symptoms of BPH. Processed and high-fat foods. A diet high in processed and high-fat foods may increase the risk of BPH. It is important to note that everyone is different, and what may be problematic for one person may not be for another. It is always a good idea to speak with a healthcare professional about your individual needs and dietary recommendations.